Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
So, the humerus is also a long bone which is having one upper end, a shaft and the lower end. Is it clear? So, what are the three parts of humerus bone? Upper end, shaft and the lower end. Is it clear?
Yes, ma'am.
Okay, so coming to the upper end, what all things you can see? Upper end you can see the head portion, correct, no? Then one neck portion, the small constricted, this portion is the neck, correct, no? Other than that, this is posterior view, this is the anterior view. Anterior view, here you can see two tubercle. What are the two tubercle here? Greater tubercle and the lesser tubercle. Then here you can see there is a groove running between those two tubercle, between the greater and lesser tubercle. What is that groove? Intertubercular groove. So this is the intertubercular groove. And on top of that you can see there is a partition between the head and rest of the upper part of the humerus. So this neck is known as anatomical neck. Did you see the anatomical neck?
Yes, ma'am.
Then from this is the portion of head. The head which is separated from the neck, there will be another neck, that is the surgical neck. Okay. So there are two neck, anatomical neck and the surgical neck. Surgical neck means it separates from the shaft of the bone. Okay. So what all things you understood in the upper portion? Upper portion, there is a head which is directed medially, backwards and upwards, and this will be the head of the humerus will be articulating with the shoulder joint. Is it clear?
Yes, ma'am.
And there are two neck, anatomical neck and the surgical neck. So the line which is separating from head from the rest of the upper end, that is the anatomical neck, and from the head to shaft, that is the surgical neck. The narrow line which is separating the upper portion of the humerus from the shaft, that is the surgical neck. And there are two tubercle, lesser tubercle and the greater tubercle. Lesser tubercle is an elevation on the anterior aspects of the upper end, and greater tubercle is an elevation in the lateral part of the upper end. Is it clear?
Okay.
Two tubercle are here. Okay. Then in between this two tubercle, you can see there is a groove. What is that groove? Intertubercular sulcus. It's a groove-like structure. So within the groove, within the intertubercular sulcus, there are three muscles. So keep in mind, one lady between two majors. Who is that lady? Latissimus dorsi. And what are the two majors? Pectoralis major and teres major. You understood?
Okay, ma'am.
See, this is what I am talking. In between these two tubercle, here you are able to see one greater tubercle, lesser tubercle, in between another tubercle. Did you see this one? Not the
Yes,
tubercle
ma'am.
groove. That is the
Groove.
marked intertubercular groove. So within the groove, you can see latissimus dorsi, pectoralis major, and the teres major. Okay.
Okay, ma'am.
Okay. Then next about the lower end. So lower end, what all things you can see actually? Two condyles are there, lateral epicondyle and the medial epicondyle. Okay. Then we can divide the other part into articular part and non-articular part. So what is articular part? Capitulum. See, this is the capitulum, and this is the trochlea. Trochlea is a pulley shaped one, and this is the capitulum. So the capitulum is what is capitulum? It's a rounded projection which articulate with the head of the radius. And trochlea is a pulley shaped structure. Okay. So this will be articulating with the trochlear notch of the ulna. So here you can see the medial edge which will project medial end, it will project 6 mm downwards and forming the carrying angle. Is it clear? So what all things we learn here? This is the lower portion of the humerus. There are two condyle, lateral epicondyle and the medial epicondyle. In between you can see articular portion and non-articular portion. Articular portion means capitulum and trochlea. Trochlea is a pulley shaped structure. Okay, so it will be articulating with the trochlear surface of the ulna. And the medial edge will be more prominent or projecting 5 mm downwards. Then it is forming a carrying angle. Then capitulum, you understood, no? This portion is the capitulum, which will be articulating with the head of the radius. Is it thorough?
Yes, ma'am.
Okay. Then we will study the non-articular part. So, which all parts are non-articular, not articulating with anyone? That is medial epicondyle. That is easily you can feel because it is very subcutaneous. So that is the medial epicondyle. The another one, lateral epicondyle. So these all are non-articular parts. So lateral epicondyle, that is small comparing with the medial epicondyle, and it has muscular impression. And next is the lateral supracondylar ridge. So where you can see lateral supracondylar ridge, just above the condyle you can see a ridge, that is the lateral condylar ridge, and medial supracondylar ridge, same. And next you can see there are some fossa. Just in front of the trochlea you can see one fossa. What is that fossa? Cornoid fossa. See, let me show the last picture again. See, this is the, not this one, this is posterior view actually. 1 second here. See, this is the one. This is the olecranon fossa where the ulna is rotating. Head of the ulna is rotating.